In reversing our position, we realize that CBT is an effective approach for those who have substance misuse issues. I learned that CBT has been successfully utilized in various settings, acute and community, and questionnaires can be a useful tool for both settings to access how one's thoughts and feelings contribute to behavior.
What I learned from CBT is that it is effective in coexisting issues for those that have substance misuse issues, such as anxiety. Deep breathing helps to decrease stress and anxiety. A person identifies the feelings and stops, takes a breath, and de-escalates.
And from your presentation of CBT, I can see the importance of establishing the connection of thoughts and feelings to the undesired behaviors. With this understanding, a psychiatric nurse and patient can plan ahead for the ways to cope in an adaptive way rather than a maladaptive way, and in essence, the patient can learn to really recognize the feelings and break the momentum before it leads to misusing substances. The patient can launch into a healthier alternative instead before he or she begins the behaviors that ultimately lead to using drugs or alcohol.
So to reverse our position and discuss the person-centered approach, I learned that every person has an inner self, and it's consisting of their creativity, their social self, certain motivations and needs, their need for hope and for high self-esteem. The person-centered approach is good because it uses this in every individual. It brings it out and increases their self-esteem, and self-esteem is really needed to move towards recovery.
Successful person-centered therapy enables an individual who is struggling with substance misuse reach self-actualization by guiding them to attain positive attitudes towards themselves, empowerment, hopefulness, and self-awareness.
Every RPN has been trained extensively in the use of empathy, genuineness, non-judgmental attitude, respect, unconditional positive regard, and active listening. So since the tools are the basis to the person-centered approach, it's easy for the RPN to use this in all counseling settings.
So Sasha, to answer your question, you had mentioned that an RPN who actively listens and emphasizes unconditional positive regard is part of the self-actualization process. To explain how the RPN contributes to this, I would have to say that it's the nonverbal communication, the consistent unconditional positive regard, and which creates a safe environment for the patient to open up and express their feelings. The person can feel free to be who they are and know that they are not going to be judged by the person that they're speaking to.
Okay, thank you. And to clarify how CBT helps to address coexisting issues, substance misuse is often because of something. There's often an underlying issue, and in fact 50% of all hospital admissions are because of substance misuse and coexisting mental health issues. So the reason and the causes behind it can be that somebody is using it to manage their mental health symptoms like anxiety, depression, stress, being socially withdrawn, or that they're taking psychiatric medications and they have side effects. Some of the side effects are that they feel really hyper and they have anxiousness, and so often people use cannabis to manage those or to manage some of the tremors associated with the side effects. The other major contributing factor to using drugs or alcohol is a history of trauma, a history of sexual abuse, neglect, and they're using that to numb their feelings. So they're very much coexisting issues and they're coexisting problems. And so CBT addresses this because it talks about the behaviors. So my response to my feelings and my thoughts are a behavior, and we talk about the behaviors.
And I'm going to address the question you had for us. How does the principles of empathy, genuineness, positive regard, active listening, non-judgment, and non-directive counseling contribute to altering a patient's own self-concepts? And And it's through using these principles that a goal is to facilitate the patient's understanding and provide insight into themselves. And this is when self-actualization occurs. And when this happens, the patient realizes that they have within themselves the strength and the resources to address issues. And when this realization occurs, their self-concept is changed from one of weakness to one of strength.
And I'm going to clarify how CBT creates feelings of self-worth and confidence in the substance misuse patient. Confidence and self-worth is gained from seeing how positive changes and achievements result from strategies such as goal setting, coping skills training, and the maintaining of interpersonal relationships and assertiveness. Confidence of a substance misuse patient may also be gained when follow-up assessments indicate their lifestyle is on a healthy track. The psychiatric nurse provides a sense of self-worth to the patient as well by using a non-judgmental and positive view. CBT also involves the patient as a collaborative member of their treatment, which strengthens their self-worth and confidence.
Okay, I see. I would like to address how PCT enhances a patient's self-esteem through building self-awareness, and that's where the connection lies in that. It is well known that the way people view themselves impacts how they experience their life. It seems apparent that those with low self-esteem do not even feel worthy of things like happiness, success, or achieving self-actualization. So therefore, one's development of self-awareness as gained through PCT can help one to realize their proven areas of personal strength. And this awareness creates or builds upon his or her own self-esteem.
I'm going to address how CBT can help individuals with substance use issues when they are not in the presence of a nurse. The RPN can encourage the client to keep a log for monitoring his or her substance use. The log can help the client to learn about situations that give him or her the urge to use substance. The RPN can provide education about the thoughts and how such thoughts hinder recovery. Awareness of thoughts can enable the client to restructure thinking. Therefore, when the client is not in the presence of the nurse, the client can use CBT techniques such as breathing and relaxation methods and modification in response to pain and anger. Thank you.
Okay, so I think we should all put away our notes and come to a conclusion.
What a great idea. Let's put away our notes.
There, no need notes.
Keep building.
So on behalf of our group, I think we've heard how the person-centered approach can help a person who is really in need of self-esteem, who really needs to understand their thoughts and their feelings. It's very similar actually to the CBT, because in CBT you need to identify the thoughts and feelings that contribute to the behavior. But from my point of view, your approach seems a little less formal. Ours actually, even though we're using a genuineness and an empathy and non-judgment, it seems that it's a little bit more confrontational, a little bit more cathartic, because we're getting people to identify behaviors that are maladaptive. We're not supporting them in those behaviors necessarily, we're hoping that they change it. So we're implementing techniques to change that behavior. Whereas, in my understanding, you're supporting all the behavior and hoping that a person takes it upon themselves to understand how that's impacting them and to make their own decisions. So it seems like it works better for different people. I know that the CBT is more of a program. Like there's a Changeways Society in Vancouver, and they do 6 or 10-week programs. That takes a lot of commitment. I don't know if everybody who uses a substance can commit to that kind of session, like if they can go in on every Saturday for an hour. Maybe the person who is very chaotic would do better with your approach. So
Yeah, I agree. I think we have a lot in common in that we approach it the same with genuineness, empathy, non-judgment, and I think, especially within our healthcare system where counseling services are not always available or they're limited, that our approach could be more useful in that situation where people, maybe they would come for counseling as needed and they don't have to commit, as you said, to like a chunk of time. I think that both approaches are person-centered in that ours is quite non-directive, and as you said, yours is more structured, but it's both valuing the individual and working towards wellness that way.
Yeah, basically I think as RPNs we develop our own sense of style in how we work with patients, and I believe that CBT and PCT can be used together, because something like CBT, like you said, involves a commitment, and even thinking about making such a commitment could be scary or intimidating for a substance misuser. So something like PCT could even be something that a patient could try. It would build their confidence. Maybe then they would be ready to commit to CBT. Or once somebody's done CBT and their therapy session is over, then PCT could be something that they could follow up with at their own leisure, at their own discretion, when they feel they need some support to continue on with their goal of not using drugs. So I think that actually both therapies could be used together. I think it's possible. I think they would complement each other very well. Thank you very much.
Thank you.
Thank you.